Hi, Dr. Windisch again from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Today we're talking about herpes virus for children. Remember, these videos are not intended to replace consultations with your physician. If you have questions, we're happy to see you here at area code 775-359-7111. We'll get you in same day. Herpes virus is actually very common, and specifically what I want to talk about is herpes gingivostomatitis, okay, herpes infections of the mouth. And we diagnose this in this office, which is a small pediatric office, maybe 4 or 5 times a year. And every time I diagnose it, it's news to parents that this actually happens. It's important to realize there are 2 types of herpes virus. Actually, there's a couple of cousins of herpes virus, but there are 2 major forms of herpes, HSV1 and HSV2. And they essentially cause cold sores. And they're everywhere. Okay, 80% of people on the planet carry HSV1 on their lips and can go on to cause cold sores. Herpes can be spread to other body parts, including your finger, that's called herpetic whitlow, and your genitalia. Genital herpes is a form of sexually transmitted disease. However, oral herpes is not. Oral herpes is everywhere. So if your child winds up with cold sores, this is not some major sign of child abuse. If you or your spouse have ever had cold sores, chances are that's how your child got it. If anybody in the family has ever had cold sores, or anybody at school has ever had cold sores, chances are that's how your child got it. The first time you get a cold sore, often the whole mouth breaks out. It can be very painful when the kids stop drinking, and we do occasionally need to give codeine for this. There's some other medicines we can give for the sores in the mouth that also help, and there's anti-herpes medicine we can use, something called acyclovir or its cousin valcyclovir. Both help to shorten the illness and if you're having a lot of outbreaks, to prevent additional outbreaks for you. It's generally not the end of the world. The kids often run low-grade fever, their gums get swollen, they bleed, they get mouth sores. It is important your child not chew his hands or lick his hands or bite his fingers and then rub his eyes. However, you can transfer this virus to your eyes. That is the one time that this is a huge to-do. Also, if your child is under 6 months of age, this is a huge deal. So if your child is a young infant, if your child has cold sore outbreak and a sudden onset red eye, you need to be seen right away. By right away, I mean this evening in the emergency room if your doctor's office is closed. If your doctor can get you in same day, that's fine. Otherwise, go to the emergency room, call your eye doctor right away. Often they'll get you in same day to take a look. Tylenol or Motrin can help with the fevers and the sores. Cold compresses, cold things to eat. Live cultured yogurt being eaten often helps. Half-strength Benadryl or Benadryl mixed with Maalox, a teaspoon of each swished around and spit out, often helps cut down some of the discomfort. But if things are really bad, come give us a call. Again, this is very common, but not so easy to treat at home, so if we can help you, we're happy to. Also remember, if your child is immune compromised, receiving chemotherapy, has HIV, call your doctor right away. If your child has had an a bone marrow transplant or an organ transplant, call your doctor right away. In immune suppressed patients, this is very dangerous. Also, if your child is a wrestler and has cold sores, they need to be seen right away. This can spread all over the body in wrestlers and again is very dangerous. If your child has severe eczema, it's important we see them right away. This can spread from scratching as well. But for most people, it's limited to the mouth and heals pretty quickly. Realize it keeps coming back, especially when you're stressed out, get a lot of sun exposure. Oftentimes, some sunscreen will help prevent that. Getting enough rest helps, and then if it keeps happening, again, we can put you on some medicines. I know this is kind of rambling on this one, and again, I keep saying it, I'll say it one more time. There's not a ton that can be done at home, but there are things we can do to shorten this illness, so call us if you're concerned this is going on. I hope this helps, and again, please don't freak out if your child has herpes. This is not the end of the world. This is not an STD in the mouth. This is common. If you need our help, give us a call, area code 775-359-7111. We'll see you next time.